I'm Dr. Prashant Chhajed, Senior Pulmonologist at Lilavati Hospital with special interest in interventional pulmonology and sleep disordered breathing. COPD stands for chronic obstructive pulmonary disease. The most common reasons for development of COPD is smoking and also exposure to irritants such as pollution, chemicals, and chula fume exposure. The theme which is being followed for World COPD Day is breathing is life, act early. So what does this mean? In those individuals who are suspected to have COPD or who are at a high risk of having COPD, we should identify them earlier, take them on prevention pathway and treat them earlier so that their symptoms are well controlled and the disease progression can be slowed down. What are the symptoms of COPD? As the word COPD includes the word chronic, these individuals have a cough which may be just ongoing for a long time. That's chronic cough. These individuals may have breathlessness on exertion, which is again insidious, starts slowly and will increase gradually. The other symptoms are chest tightness or wheezing, particularly when these individuals have a flare-up of the COPD, that is a flare-up of the chronic obstructive pulmonary disease. How does one suspect COPD? If you have any of these symptoms, including chronic or rather repeated respiratory infections in an individual who is at high risk such as smoking, one must suspect COPD. How does one diagnose COPD? Along with the symptomatology, clinical examination is important, where there are certain signs which your physician may pick up, may indicate the possibility of COPD. Pulmonary function testing is the mainstay, that is the PFT. It's a very important test to diagnose COPD. So anytime a diagnosis of COPD is considered, one must undergo a very simple test called as a pulmonary function test. Imaging also plays an important role in patients with COPD, particularly if they have a flare-up of COPD or if they've got an infective exacerbation of COPD. The imaging includes X-ray chest and a high-resolution CT scan, which may contribute and support and help us to quantify the severity of COPD or the presence of COPD. Once COPD is diagnosed, what are the important things that are encompassed in the comprehensive care? One is inhaler therapy, second is nutrition, and thirdly is regular exercise or pulmonary rehabilitation. Inhaler therapy forms the mainstay for patients with COPD because the dosage which the inhaler delivers to the lungs are small and the medicine just goes where it is required. Therefore, it's important to follow the inhaler therapy on the regular basis as advised by the physician. Individuals with COPD also need good nourishment, and therefore your doctor will advise you regarding the nourishment or the nutrition support that is important, and often high protein diet is important. Of course, high protein diet may be restricted in certain comorbid conditions, but you should consult your doctor before embarking on this therapy. Regular exercise when you've got an early COPD or a mild COPD can be done by the own individual. As the COPD advances and the individual is restricted in activities, it's very important to take on to pulmonary rehabilitation, which can be done with the help of a physiotherapist. Pulmonary rehab exercises can be done in the hospital setting and also can be done at home, where the physiotherapist guides an individual to maintain the muscle tone well. This is an important part of COPD treatment. Vaccinations are important to reduce the severity of infections, and therefore the influenza vaccine and the pneumococcal vaccine are important measures, and please discuss about vaccination also with your doctor.